Not only is stress up during the pandemic, but many Americans are bringing back an old but bad habit, and I'm talking about smoking. Dr. Tim Irvin of IKP Family Medicine and Renaissance Organized Physicians joins us live to help talk more about this. Good morning to you. What do you think is going on with smoking? Is it do you feel like stress, or maybe people have been bored, stuck at home the past year?
Oh, certainly. Certainly I do. And not surprising considering what we've dealt with over the last several months. COVID pandemic, both medically and financially for families. I certainly would expect an increased risk of stress and anxiety, increased risk of boredom, isolation, being stuck at home, increased use of tobacco simply going along with the increased consumption of alcohol during this time period.
I,
There's also
oh, go ahead.
there's also I was going to say there's also an interesting article out of Harvard that said decreased barriers. Most of the time when we go to work, we're in a smoke-free environment. Staying at home these days without that penalty that being frowned on about your other workers, the increased number of cigarettes we're smoking and just picking up the habit certainly has played a part.
Yeah, it all makes sense, but I think it's really important for people just to take a pause and think about their life, their health, and the risks involved in this. I know that's not a fun part of it, but it definitely goes along with it. Can you talk about some of those health risks?
Absolutely. I think the biggest scare we have is with lung cancer. Small cell lung cancer, direct correlation with the number of cigarettes we smoke. Then there's certainly heart disease and stroke go along hand in hand. Lung diseases such as COPD, emphysema is the old name, chronic bronchitis, and certainly diabetes. 2014 Journal of Surgeons report showed that there's a direct correlation with increased risk of diabetes going along with the number of cigarettes you smoke.
All right, let's help everybody if they're saying, oh no, I don't want any of that, I want to kick the habit. Do you have some strategies that you could offer or give some good ideas?
First and foremost, probably the most important thing is to pick a solid quit date. Best advice ever. No one likes letting themselves down. Having a hard deadline, is paramount in quitting to smoke. And then try and avoid those triggers or situations that increase your risk of smoking. If you find yourself picking up a cigarette when you go to happy hour, try to stay away from that for a couple months until you know that temptation is not going to be there. Certainly seeking support from family and friends. They want you to be around for a long time. Ask for help. I can't imagine anyone will not be willing to help you. And then certainly identifying the reasons why you smoke. Is it from camaraderie, like I mentioned, the happy hours? Is it from a stress or anxiety? Or is it just you've been smoking so long you have a physical dependence on the nicotine? And then I guess lastly, visit with your physician. That's what we're here for. We're here to help. Don't do it alone. We're always there to assist you in quitting. You can visit with, discuss the underlying reasons, whether it's anxiety and stress, whether it's a physical dependence, and we can help cater a plan for you to be successful.
And we're almost out of time, but I want to see if you might have some resource ideas for our community, for people to perhaps improve their mental health where they don't have to turn to tobacco for help.
Certainly, and again, coming and starting off here, there's wonderful mental health providers out there. As primary care physicians, we do a fair amount of that ourselves. But starting here is always a good place because we can send you in the right direction.
Dr. Irvin, important advice today. Thank you for sharing that with our viewers. I hope you have a nice weekend.
Thank you for having me on.
All right.